Hello, guys. It is Friday, August 6th, 2021, and I am coming to you from my Facebook page, Your Body in Balance. I'm Dr. Shelley Coleman Glover. I am a board certified gynecologist. I specialize in anti aging, wellness, minimally invasive surgeries, and bioidentical hormone therapy. I also have a master's in public health and maternal and child health, and I've been coming to you live pretty much since the beginning of the pandemic, weekly, giving you updates on what has been going on with COVID. This week, I'm very excited because I have a great guest speaker who's been on with us before, who has a wealth of knowledge, and I will introduce her just shortly so that she can help us discuss some more about, hey, it's back to school and what does that really mean, and about the Delta variant, and any other questions that you guys have so that we can have a good interactive session and it's not just me that you are hearing from. Real quick for the data, as we always do, first of all, I am located in Central Florida. My office is in Claremont, Florida, which is a suburb of Orlando, Florida. So we do tend to give information both on I do kind of hone in on Florida a lot, as well as across the country. So we try to keep it both ways. The data as of August 6th, 2021, as far as our worldwide cases of COVID, we are now over 200 million. We're at 201.6 million cases, 4.28 million deaths across the world. Yes, 181 million recovered. And then as far as vaccinations, 15.2% of the whole throughout the world have been fully vaccinated. In the United States, we're at 36.3 million cases of COVID, 631.8 million thousand deaths, excuse me, guys, thousand deaths, and 29.8 million recovered. Our fully vaccinated rate has now finally exceeded 50%, just slid in. We're at 50.5% fully vaccinated across the United States. And partially vaccinated, we're at over 391 million. Within the numbers, as far as I wanted to just go back just so that we could see, because, you hear these numbers and they just kind of all start to meld in there together, and it doesn't quite mean anything to a lot of people. But to put things in perspective, we are up from June 4th, so basically 2 months ago, almost to the day, there were 34.2 million cases of COVID and 611,000 people dead in the United States. We're now at 36.3 million and 631,000. That's a lot more people that have died in the last 2 months. So, and who have contracted COVID in the last 2 months. And so I think it's important to kind of understand that, because it just sounds like blah 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 numbers a lot of times, and we kind of blow them off because we just keep hearing them, and it just doesn't seem to be it just kind of gets, we kind of get jaded with it. But we have to remember that each one of those people, those 631 people, that was a person, that was somebody's loved one, that was somebody's mother, son, daughter, sister, and they're no longer here. And to them, that one life is extremely, extremely important, and it's not just a statistic. So we just have to kind of keep that in mind. Worldwide, India comes behind the United States with 31.9 million cases and 628,000 deaths. Brazil still has more deaths than India, once again, because they had that more aggressive variant come in, the Brazilian variant come in earlier on, and they did not have their hospitals got inundated very quickly, and so their death toll had gone up exponentially before India's did, it still continues to go up, whereas India's has kind of skyrocketed compared to where it was about 4 months ago. Within the United States, California is now at 4.1 million cases and 64.7 thousand deaths. Texas at 3.2 million with 53.7 thousand deaths. And Florida is at 2.7 million cases with 39.4 thousand deaths. Once again, back in June, 2 months ago, we were looking at the death toll in Florida was 36.9 thousand. So that means that we've had over 3,000 deaths in the last 2 months here in Florida. And then U.S., the numbers are the I mean, and California was 3.8 million. It's now at 4.1 million with 63.3 thousand deaths. Of concern of the new cases, Florida makes up about a fourth of the new cases being diagnosed currently throughout the United States. So our numbers are starting to go up exponentially, as are our hospitalizations and our ICU admissions. So there's definitely been a significant, if you look at the graph, it kind of goes straight up. I mean, it's not just like a little bit of a bump. We're like headed up in a almost a 90-degree trajectory upward in the number of hospitalizations and also in the number of ICU admissions, unfortunately. We do not have reporting within Florida on all of our statistics as far as our percentages. That stopped in June, but I can tell you that we do have 2.68 million cases. We went over that in Florida. And then in Orange County, which is where I live, it's 163,000 cases. Lake County, where my office is 35.6 thousand. Much smaller county, of course. But to put things in perspective, 2 months ago, we were at 140,000 in Orange County, and Lake County was 30,000. And so we have added in another 5,000 cases over the last 2 months. So COVID is not gone. It is not going away, and I can tell you, like I said, that when we look at hospitalizations, they are actually going up exponentially. Also, because we're talking about the kids, it's back to school, I wanted to just give you a little bit of data on the children. Their children are getting COVID. Yes, compared to adults, it is still a much lower number, but every child that gets COVID is one child too many, and every child that ends up in the hospital or dies is one child too many. There were 4.2 million cases as of this data is from the end of July, so this is a week old data that I just pulled, but it's 4.2 million COVID cases diagnosed in children as of July 29th, with 14.3%. That's 14.3% of all COVID cases, and there were 71 thousand new cases just diagnosed, period, in the last week of July in children. As far as hospitalizations, yes, luckily our children, the majority of the children that get ill do not become severely ill, and that is a blessing. We certainly do not want that to be the case. However, there are children that are getting sick and they are ending up in the hospital. So on the states that are reporting, there's about 43 states reporting. There was 1.3 to 3.5% of total hospitalizations were children, and about 0.1 to 1.9%, depending on the state, of children diagnosed with COVID were the ones that were being hospitalized. And so that goes along with the fact that we know that within the adult population, usually we're looking at about a 5% to 10, depending on your state currently, but about a 5 to 10% hospitalization rate out of the number of people and adults that are getting extremely ill, and then a 2% risk of severe morbidity or mortality. So that's our data, our statistics for this week. I want to just kind of get that out of the way. Yeah, a little bit boring, but definitely necessary. And then I wanted to introduce you to our guest, Dr. Priya Bansal. She has been with us before, and she is a allergist and immunologist in St. Charles, Illinois. She has a private practice there, and then she's also a member of the it's the American. Let me just read it because I'm going to mess it up. The American Academy of Allergy, Asthma, and Immunology COVID-19 Task Force. So she has a wealth of knowledge, and the great thing about her is that she is very down to earth, so she's able to explain things to people and not go way over your head, which of course some physicians do. And then the other thing that's great is that she is actually what we call triple boarded. So she is actually board certified in medicine, in allergy and immunology, and in pediatrics. So I would like to welcome her to our stage. Dr. Banzal, welcome, and let me unmute you. Hold on one second. Oops, now you're unmuted. Can you say something? You are muted you have muted yourself. Let's see. Hold on, let me see if I can unmute you. I muted you just now. Hold on. Guys, there's always technicals that can occur. Hold on. It says guest has muted themselves. And I don't know that I can control that. Do you want to
Okay, let
just
me try to
disconnect?
come back in.
You just let me. I
Okay.
just heard you. All right, guys. I need a thumbs up. Can anybody else hear Dr. Banzal, or is it just me?
Oh, good. Okay, so we're back on.
I think so. Can I get a thumbs up? Can anybody else? Can everybody hear her?
Okay, so hopefully,
There's a little delay.
I know I
There's a.
see the delay too. Do you want me to go out and come back in just for a
I think
sec?
that would be good.
Okay, let
Yes.
me do that.
Okay. Thank you. Hey, we are physicians. We are not tech people, so you have to kind of bear with us because it is definitely not always, smooth sailing when we do these things, right? Okay, let's see. She is back. Let's see if we can bring her back in. Okay, and see if we can pull it off this time. All right, let's see. Say something. It keeps saying you muted yourself.
Let's see, how does that feel?
Okay, there you go.
I know, and I haven't touched anything. Here we go.
But I don't hear a delay this time, so that's good. I think we're good. And
Okay,
so
so that's a
welcome.
good thing. Yes.
And I hope I did a good enough introduction. Did you hear your introduction?
Yes, I did. Thank you so much. I appreciate it. Thanks for having me back on the show.
Definitely, definitely. Thank you for being here. So I basically, like I said, we are pretty much going back to school here in Florida. We're going back to school next week. Our schools, our public schools are back in Central Florida, are back in school as of August 10th. So in Orange County, and I think Lake County is about the same. I think they're starting next week too. I think actually Georgia may have started this week. They actually start, I think, a week before us. So definitely there are school systems going back. I know up
Okay.
north sometimes they don't go back until after the Labor Day. But here, of course, we have lots of people that have lots of questions and concerns because, of course, at this point, the vaccine is only approved for people 12 and older. So we've got this whole group of younger kids that are not vaccinated. And then we
Yeah.
also have people that are concerned about the vaccines and whether or not their children should be vaccinated. So we've got like the whole gamut, right, of people. And then we all want to get our kids
Yeah.
back to school. We want them to be as healthy as possible. And so let's talk about. I would like you to just kind of brush on. You heard what I came across as far as statistics, and those are from American Academy of Pediatrics and also the state run organization. So they work together on the COVID statistics. So. Are children truly getting COVID? Is this something we should be worrying about in children? And what are your thoughts about masking going back into school?
It's very interesting. At the beginning there was kind of this myth or this misnomer that children don't get sick, right? So that's clearly not the case. Like if we've seen across the numbers, we've had more than 4 million children who've had COVID throughout the world. So basically you have about between 14 and 15% of the people affected are children. Now, what we're not seeing as much of is like the death and some of those complications, that we're seeing in some of the elderly population. The difference, I think, here with Delta, which you've probably heard, especially some of the southern states that are more affected, you are starting to see that with Delta, you're getting that rise because of the contagiousness of Delta. So, because it is so contagious, it is just passing that much more quickly. It's putting that much more of a viral load on the body. So, this statistic, which was closer to 14 to 15%, has jumped to almost 19% of those affected are children. And the true question is like, what are we going to start to see with hospitalizations for children? And I think the reason that people are worried is a little bit multifold. First of all, that's the population that hasn't been vaccinated, or even if the vaccine's been offered, we're not seeing as big of an uptick in that particular population. I think the other issue that's going on is that these children, we're having other infections, right? Stuff that we didn't see, and now people are gathering, right? So we're starting to see RSV. some of these other infections that require oxygen, may require hospitalization. So those are taking up hospital beds, right? So if you have a child who gets COVID that requires oxygen or some kind of hospitalization, you might be competing for that hospital bed because there's other childhood illnesses that bring you to the hospital, especially in the fall, right? So I think that's one of the big concerns with the hospital system is that they're worried that, okay, well now we've got this surge with Delta going on, but there's also the routine viruses that can hospitalize children. And I think the third part of this is realizing that children, they can get those other complications. Well, the two of them being one is MIS-C, which is multi-inflammatory, it's a multi-inflammatory syndrome where different organs can get inflamed. Type C, which is has been connected with COVID. They can also get long-term complications, and we just don't know. Even if you
Right.
have mild COVID, you can have complications. And the hard part is whether it's an adult or a child, I wish I could predict. I think that would make this pandemic a heck of a lot easier is saying, oh, you're going to have a problem, you're going to have no symptoms. And
Right.
our problem right now is we can't predict it. We can't predict it for kids, we can't predict it for adults. So those are kind of the complication and the issues that I'm seeing kind of going into the fall. Now, when you come to your question of masking, because of those complications, so let me just tell you like some good things that have happened with masking. We've noticed a 40% decline in asthma. That's tremendous, right? People are not, their lungs are healing, they're not getting asthma flares. So one of the things is, well, not only are you not getting COVID-19, or preventing yourself from COVID-19, you're not getting some of these other respiratory syndromes that people are getting, can traditionally get hospitalized with, right? Or you're not, not getting that pneumonia or that asthma attack or that bronchitis. So I don't know as a patient if you felt that, but the two reasons to advocate for masking, even if you are vaccinated or double vaccinated, one is because we are seeing some breakthrough with Delta. We're not saying that the vaccine doesn't work, right? It's the vaccine's designed to prevent you from getting hospitalized and from serious illness. And on that front, it's completely working.
Right.
But we're still not saying that you're not going to get it and you are not going to pass it, right?
Right.
And particularly in that younger population, um, I read this cute article and one of the physicians there said, oh, kids have this pesky habit of living with their parents, So if you're living with your parents, you can pass it to your parents, your grandparents, and unfortunately in the clinic, that's what I'm starting to see is whole families come in infected and the child is the nidus, and then double vaccinated parents or grandparents are beginning to get the disease.
Right. And definitely, I mean, I have colleagues, and that's exactly, I mean, pretty much all of the colleagues that I know that have, not all, but the majority of the colleagues that I
Yes,
know who've actually contracted COVID, it's been their child. Their child comes home, their child's sick
yes,
one day, and boom, they're down. And so it's definitely they do. Kids are affectionate. They most of them, and they're touchy feely, and they then touch and feel on you, and then it tends to spread pretty quickly. And of course, as parents, what do? We take care of our kids. We're not going to not take care of them. We're not
of
going to touch
course,
them. We're
of
not going to
course.
hug them if they're feeling sick. And so even the kids that don't want you touching them other times when they're sick, they want a lot of loving. And so yes, it does spread very quickly. And the current thought is that there's about 1,000 more copies of the Delta variant in
Yeah.
the nose, in the nasal passages compared to the original variant. And that's why, even though we thought that one was outrageously um, contagious, this one is just like the original COVID vaccine on steroids, and just has really amped up on the level of transmissibility. And I think for people that haven't been on the show, haven't been following, we've been talking about Delta for the last couple of weeks, but there is so the things that we're applying to the original COVID um, variant are no longer applicable. We're not saying that if you maintain your 6 foot distance away that you're going to be okay, that you can't get it. So that's where the mask mandate is coming back in, and so it's the reason why people that are vaccinated, the recommendation um, is that people be vaccinated and wear the mask is because you can still get the COVID, even if it doesn't mean the vaccine. Remember, the vaccines never promised 100%. So when you have over 600, almost 700 million people that have been vaccinated, you're gonna have several thousand people that are gonna get COVID. Just it doesn't mean that it's not working. I think that that's one of the things that we get is people go, oh, well, why get vaccinated? It doesn't work anyway. But as Dr. Banzal said, it keeps you out of the hospital, out of the ICU, and out of the morgue. Those are the three things we're looking for. And the vaccine is very good at that. Are there people that die that have been vaccinated and get COVID? Yes. There are people that, you can do everything right. You could sit still and not move an inch and you can still die. You're going to die. And so, there's always people that don't, they get the short end of the stick, and that's just life. I mean, you can also, go out here and get hit by a truck. You have a much higher risk of that. I tell patients all the time, we take our lives in our hand every time we get behind the wheel of a car. And we do it multiple times a day. We don't sit there and go, oh my God, I might die today. I don't think I better go outside. I mean, we do it, and that's life, and that's a bad thing for that person, and certainly that's one life loss that we would hope to had not been changed. But that doesn't mean that the other millions of people that it's protecting, that it's not a good thing. And so,
which is kind of, if you go back and look at even like seatbelts, right? When they first came out, how outraged people were about having to wear seatbelts.
Right.
Outraged when you had to get like seatbelts, and because all of us used to, I mean, I remember riding in the back seat of the station wagon, just laying on the back. I mean, just completely unsafe. And now it's very commonplace. You don't see anybody without, buckling up in those first two, especially the front seats. But we've seen a lot more people being good about even just, buckling up in the back seats.
Right.
And so, I mean, the seat belts, car seats, there were so many things, right? So so I know people are really worried about, the vaccine and what's going on. And just because something's new or changing doesn't make it bad, just the way like seat belts didn't make it bad or car seats didn't make it bad. There's, we're going to learn how to do new things and how to make them better. The shingles vaccine that originally came out had about a 50% efficacy, and now we're up to 80 to 90% efficacy with the new vaccine with the new technologies. So as things evolve, you are going to see better things come out and things improve. So, if a newer vaccine comes down the road and it's like, oh, why did we get this one? This is so much better. Well, it's better because, time and evolution and research, right? So we do want things to get better as time goes on. So, I mean, this is just par for the course, I think.
Definitely. And what? Oh Lord, just lost the train of thought we were talking about. So so just to go back to the mask, just real quick, just that you're wearing the mask so if you're vaccinated, you're wearing the mask to protect other people. So you don't want to get it because you don't want to then give it to somebody else that's unvaccinated or somebody that maybe become ill, or heaven forbid like I said, like for me, I always tell people, it's not even just, I don't want to, of course I don't want to end up in the hospital. I certainly don't want to end up in the morgue, but I can't afford to be sick at all. My patients need me.
Well, and that's the thing, right? Because then you're quarantined for the 2 weeks. Like it's bigger implications than that.
It's huge.
So for me, and I would feel terrible, giving it to like knowingly giving it to someone, right? So,
Yes.
for myself, again, I've been back to masking, going to the grocery store, masking, going, when I got my nails, like this is, and I think people, when you look at other people, it's easy to judge, but you also have to look at in healthcare what we've seen, right? How much sadness and trauma and, how many deaths and it just a lot of sadness, coming across in healthcare and some of the long-term implications of COVID. So for me, because I mask all day long in clinic, it's not that big of a deal for me to go and mask when I am, indoors. And, in Florida specifically, I think it's been a bigger issue. I read this interesting article about, Florida specifically, or some of the southern states where, it's more like winter. They're like, oh, the Florida summer is more like winter. And I was like, how is this? And it's basically because, our winter, we're indoors, but it's so hot there that you guys are more indoors, where again, the transmissibility of this is so much higher.
I
Yeah.
didn't think
So
about
this
that.
is
That's
like
interesting.
yeah. So
See?
that's, so then that could be adding to it, as
Yes.
far as like what's going on. Because like for you, it's so hot that you need the AC. You guys are indoors more. Whereas, in other places, okay, we might be getting a little bit of a break right now, but again, things might change in the fall when we end up having to be more indoors, you know?
Wow. I like that. I like that. Never thought about it that way. That's pretty interesting. But yeah, and I think that that's
Yeah.
one of the things that was interesting. I heard, one of the things that I heard last winter was, when you talk about the people that have the conspiracy theories and stuff, they're like, well, where did all the influenza go? Nobody got flu, so everybody got COVID, so they're just labeling everybody COVID, and that probably has flu. But I think that one of the things was we were quarantined, so we weren't around a lot of people, and people were masking, and so we had a marked decrease in the flu outbreak because of protecting against COVID. So
Yeah, and that's like you said, it's like all the respiratory viruses that we were talking about and it was interesting, like in the summer, once people started gathering again, you started to see the emergence of these respiratory viruses again, right? When you're getting together en masse. So there's a whole slew of viruses that, that are spread airborne, right? That you're not going to be contracting if you're wearing a mask and, kind of distancing and being a little bit more careful with hand washing and things like that.
and that's kind of funny because, of course, one of the complaints that the people that don't want to wear masks say, well, I don't want to wear it because I have asthma. And so, you know,
Oh no, I blatantly say that's not an excuse. I have asthma, I wear my mask. So yeah, they've done multiple studies showing that that is not true.
right,
That even with asthma, you should be able to safely wear a mask. It does not take down your oxygen saturations whatsoever. So
right.
um,
Yeah, unless they're
again,
walking
finding
around
a
with the huge
material
absorbents.
maybe.
What'd you say?
Yeah, I mean, just finding a material. I would think the thing, maybe just think about finding a material you like, play around with the surgical mask versus the cloth mask versus something that's more sportsy. I think just messing around with some of the materials, you can always find something that is more comfortable to you,
And I
you
have
know?
been through a billion masks. So I'm sure
Yeah.
you have too. And I will tell you what I keep going back to is the regular old three ply um, regular mask. Like I will put
The
on my
surgical,
K.
yeah,
Yeah,
that's a
I'm
little,
looking for one
yeah.
I got. I usually have them everywhere. But just the regular ones, guys. Just the
Yeah,
paper ones
just
you
the
can buy
regular like
anywhere.
blue,
Yeah,
yeah,
the
the
blue
blue
ones you
ones.
can
And
buy anywhere.
honestly,
I
you
usually have
can
a
breathe
billion
through
of them.
those.
You
No,
can
and then
talk,
they're
they're
so
the best to talk.
breathable.
Right, and that's the
Yes.
thing. I mean, we
Hmm.
talk all day long. I do. I talk a lot. And so, I mean, I do, consultations all day long. And so I'm talking, talking, talking. And so, yes, it's a pain if you have the wrong mask. So I bought the cute ones. People have bought me ones, the cloth ones and all of that. When you're talking, they're fine when you're looking cute. But if you start opening your mouth and you're talking a lot, like it moves, and so then it's a pain in the butt, and then you're sitting there. I have to actually sit there and hold it in place, or I'm constantly putting in there. So I just always end up back onto the regular old three-ply mask, and I just find that they're lightweight, especially in the summer. You can't be in an occlusive cloth mask because you're going to get hot. Now, when I go on the plane and stuff like that, if I'm going to be in a situation that's going to start giving me the heebie-jeebies, then I will pull out my KN95 and I'll wear that. But otherwise, I just find
Right.
that the lightweight one is really good, and that's part of probably reason why we get so much pushback on the mask from people is because they're wearing the wrong mask. And
Well,
yes, they
that's
can
what
be
I'm
yucky.
saying. Finding something that's like more comfortable to you, I think, like I said, makes it a little easier. And, like I said, I know people have been, it's kind of like you want to respect everyone's rights, but, by the same token, even if somebody's wearing a mask, respect the right that they're wearing the mask, because I
Right.
remember I was at the dry cleaners, several weeks ago, and I had a man just go on and on because I had my mask on, and just was like, you don't need to be wearing that anymore, blah 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 blah, and I was like, again, it's a choice, right? Because I don't want to get anything, I don't want to carry it, I can't afford to be out for 2 weeks. Like this is a choice that works for me in terms
Right.
of keeping myself and obviously all my patients safe and
Right.
family safe, of course.
Right.
Yeah.
And I mean, and I think that that's the thing when we start talking about going back to school. We have to look at it, and so we have. Um, people that say, well, do we mask, do we not mask, do we vaccinate, do we not vaccinate? The thing is that both in healthcare and in these public service places, our goal is to do no, our oath is to do no harm. And so, if you come in my office, I want you to leave my office as healthy as you came in. And so that's why, we've never stopped masking, within the healthcare setting. Well, at
No.
least most. And I actually, because my staff, when things were better, when the numbers were going down, my staff was kind of saying, we're fully vaccinated, can we let go of the mask? And I just said, I no, we got to keep it up because we don't know who's walking through the door. And of course, it's an honor policy, so we don't know who's unvaccinated and walking through the door. And we don't want to, we just want to make sure. That's before we knew, that's when we thought that we were okay. We thought we were bulletproof. And now we realize we're not. So,
Right, right. And we like did something similar in the office. I would say, before I wasn't allowing any food or drink, in the office, and I'd say you'd have to go outside to kind of take your break or, do whatever, eat in your car. There's a break room downstairs. I'm like, we can't congregate anywhere where people are together. And it was more lax on that after, both, the office staff was vaccinated. But again, just this past week, we went back, our community level's gone up. So we went back to, okay, you cannot eat or drink back in the office again. It is, unfortunately, it is what it is,
right, right.
so.
And everybody has to set their own things. And I mean, I think that overall, I mean, I know that people think from Florida that we're the Wild West or the uh, I think did we lose her? I'm not sure. If so, she'll come right back. But what I was saying
No,
is
you
that,
should be there.
oh,
Yeah.
oh, there you go.
Oh, there, it went
I was
away.
saying, it sounds like we're really bad down here, and I guess we may be different than most other places, especially up north. I will definitely say when I travel that it is definitely a different feel up north than it is down here. But I would say that um, overall, we didn't really have, people have been fairly respectful about wearing the mask if it's dictated. We don't get much flack from the patients about, coming into the office. We just have a note saying, per recommendation, in a healthcare setting, masks are recommended. And I think that, the bottom line is we want to keep our schools open. We don't want to go into this whole thing where, you know, um, they're having to close down schools, or they're having, because you got to remember the teachers have to be healthy too. And so if the teacher has to go out on quarantine, then that takes away from your child being able to learn. So if we want our children to be in school, if that's what we say we want, and we want them to stay in school, and we want our school, and we want them to have the socialization and stuff, the easiest thing is actually to have, to me personally, is to have everybody masked and you don't have to worry about it. And that way, it's always better to over than to underdo, and to find out later that, uh-oh, now we've got, half the population is getting wiped out, and blah 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 blah. So, all right, let's see what else we want to talk about. So, talk about, please, the I told you that I just recently heard someone say that they thought that the Delta variant was not the big bad ugly, and that it was really more of, and I don't get into politics, that I don't, I just don't. This is a medical problem. This is not. This is it. This COVID-19 is a medical issue. It should never be in the political realm. So I don't get down on those rabbit holes, but I just want, from a medical standpoint, your thought process on the level of, is the Delta variant actually more virulent, or is it just more contagious? What is the thought of the COVID task force as far as that's concerned? Because I know that has vacillated. Uh, Wait a minute, hold on. I don't. You muted yourself again. Still muted. Let's
I don't
see.
know if
And
you can
maybe, okay, there
hear.
you
Can
go.
you hear?
Yes. Sorry about
Okay.
that.
Okay, we're back.
Yeah.
I don't know why it goes the way. But yeah, no, what we've shown is that definitely it's more virulent, right? I mean, more contagious. I mean, so like, definitely we've seen like a thousandfold, like that it's so much more contagious, which is why we're seeing kids get it more. You're also seeing, like you said, that huge high viral load in the nose, right? So the transmissibility of that is a lot higher. I don't think they've shown necessarily that you're going to get a lot more damage specifically with Delta, but I think it's because the viral load is so high and on how contagious it is. That's why you're seeing all of these people that are turning COVID positive. We are still seeing, like I said, in the double vaccinated group, that they may get no symptoms, they may get mild symptoms. Overall, majority are staying out of the hospital and out of the ICU. So in that sense, it's still behaving like, especially in that double vaccinated group, it's behaving like the other strains we've seen. But the fact of the matter is that it is so contagious. And I think
Right.
that's why it's gaining so much press and so much attention, is because of how contagious it is and how fast it ramps up and how fast the viral load and how quick somebody turns positive. Before we're like, okay, 5 to 7 days, whereas Delta
No,
is
it's in
pretty much
4.
you're symptomatic by day 4. Yeah.
Right.
So I
Yeah.
think that's where you're seeing the main differences, I would say.
And okay. And what about the this newer one that we're hearing about? I think it's about a 10% in uh, southern Florida that we're hearing about, the Lambda variant. Can you tell us a little bit about that one?
Yeah. So Lambda, uh, Lambda came out, I think, first in Peru in December 2020. So originally was more confined to that area. Again, you didn't hear a lot of press in this area necessarily about it because it was more confined over there. I think the reason they're worried again is because global impact, right? Like we're starting to see it over here. So far, the question is, they didn't really show the vaccines work that great, but also they were different vaccines. They
Okay.
had
Yes.
Sinovac, as far as my belief is. So they haven't looked at it compared to the Moderna or the Pfizer or the J&J. So we haven't studied it with that.
Okay.
So I think the concern is coming from the vaccine that they had didn't work that great against Lambda. It was in Peru, but now it's making its way to the US. So that's kind of why it's generating a little bit of waves, because people are kind of curious, okay, is the Pfizer or Moderna how is it going to work with Lambda specifically? And is this headed to be another global phenomena? And this is what viruses do, right? So we are going to see countless strains come out of this, right? Because viruses are smart. They're just like, okay,
Mm-hmm.
you're not letting me in this way. Let me change my form so I can get in this way. And that's why the flu vaccine for years has been so hard to pin down, right? Because every year you're using last year's strains to be able to predict the following year, but the virus is smart and it mutates, right? It changes its shape and form, and sometimes you get lucky and you get better efficacy, and sometimes you're unlucky and it mutated itself so much that, it's not, what you're using is not going to work. So I think, the virus is going to do what it's going to do, which is kind of why everybody's on that soapbox of you have to vaccinate, because the less vectors that you have to be able to pass this, the more successful it's going to be in the long run, so that we don't have to keep listening about Lambda and, like all these epsilon, like all these other variants that are emerging. So,
Right. And I think that it's, we're not saying that COVID's going to go away. It's
no.
that would be great, but the likelihood is it's not, and especially the way it's kind of dragging out, it's not going to go away anytime soon. And so as long as it's still there, on, simmering somewhere, you're going to be able, the virus is going to be able to mutate, and you're going to be potentially able to see new variants. And so yes, the it's just the nature of the beast. It's just going to happen. So, what about people that say, well, I've had COVID. and so I'm naturally immune. Why do I need to get the vaccine?
It's interesting. I've had this discussion quite a few times with patients, and we've shown that if you get even like one dose of the Pfizer, like they're thinking that these people might even develop like lifelong, immunity. I mean, it's yet to be seen. But basically, when you get COVID, that's triggering a certain part of your immune system. Whereas when you're getting the vaccine, that's kind of working in a different area. This is triggered by the spike proteins. So because you're kind of complementing the immunity that you got when you had COVID, they think your response is exponentially better than even any of us who are going to get the vaccine. So to me, the main reason if you've had COVID to get the vaccine, well, there's several. One is that you may develop lifelong immunity, right, after this. The second is, and like I said, that's yet to be determined as we go through all these variations. But they're saying that better than the vaccine alone or better than COVID alone, we know that somebody who's had COVID and is vaccinated has even better immunity. The other thing is that, like, let's say that you've had COVID, it doesn't preclude you. I mean, just in the past week, I've already had my people who've had COVID. They're coming in with their second round of COVID now. So this just because it's not a one and done deal, just like how if you get the flu, it doesn't mean you're never going to get the flu later in your life, right? You can get the flu every year. It just depends on who you're exposed to. And like I said, again, keeping in mind with Delta, it's where it's been on the news. It's like as contagious as chicken pox, which is making it like if I'm exposed to you, like, or let's say I'm infected, I'm on average going to infect 8 other people, which is a lot. It's like not like you're infecting 1 to 1, it's 1 to 8, right? That's like how contagious. That's kind of why now we're seeing the second round. So just because you had it once, it's not like, oh, I'm immune for life. That's not the case at all. So getting the vaccine actually puts you in a much prettier position with that.
Right. And I think that's what people need to hear. I mean, that's what I've said is that it's not, it's, that it's, immunity can wane, and um, just because you've had it, it doesn't mean you can't get a different strain of COVID. Just like you can have flu and you can get another strain of flu.
Right.
And so then, of course, then people, well, then why am I going to get vaccinated if
Mm-hmm.
this is going to be needed for another vaccine? And well, just like you get a flu vaccine, different. As you said before, things evolve. So yes, there may be a need for additional boosters, and it's just life, and
Yeah.
it's just what we do. I mean, it's just what we do. Just because you're on one blood pressure medication, if there's another one that comes along that's markedly better, you're not going to stay on the one you're on because you're going to be stubborn and say, well, I've been on this one long enough, and I'm just going to stay here, even though there's way better medication out there for you. So we have to do what's best for our bodies, best for ourselves, and best for the welfare of our whole nation. So what about because now we know that there is uh, uh, some talk about doing a third booster. And so, of course, based on what we just said, yes, there may be a need. But right now, currently, is the thought process that there really is a need to go out? It seems like the Moderna and the Pfizer are doing a pretty good job of protecting against the Delta variant as far as keeping you out of the hospital, out of the ICU, out of the morgue. So, what are because that's about to come through where Pfizer is going to basically be approved for that third booster. So people are going to be wanting to know, should I get it? So should they get it? What's the current thought process?
It's interesting. I find that a little bit controversial, right? So, and I've been looking, and honestly, the number of texts that I've gotten this week out of all my physician friends and other friends asking me, "What do you think? Should I get it? Should I not get it?" And like I said, it's very it's a hot button topic, because the WHO came out with a statement saying, "Hey, we need to vaccinate because only there's people throughout the world who haven't received the vaccine, and we need to make them a priority, and not people shouldn't be giving boosters." In spite of that, Israel, Germany, and France have started to give booster in their most vulnerable population, which is your 60 and older. They've started to give boosters. And the question for me is also the type of booster. So the question is, if you go and you go get your booster, uh, that which is the booster of the same vaccine, you're increasing those antibodies, but is that really accounting for the variation in the changes with now that have come about with Delta and Lambda? Or should we wait for, which is also being studied, is a booster where they've altered those spike proteins to account for those mutations, right? So the question is, do you go now? Do you go later? And I think the people that are the most concerned right now and really wanting these boosters the most are healthcare workers, or who should be prioritized again would be, I would say, healthcare workers. Because again, we're doing testing, like I look at people who cough, cough and sneeze in my face all day long, right? So for, it's a healthcare worker who has that direct exposure, as well as those that are 60 and up. So I think like at the moment it's a very like I'm waiting because like I said our CDC and FDA have said, well, we're keeping you out of the hospital. The vaccines were never designed not to make you symptomatic, so it's doing its job. So even though the efficacy has gone from like let's say 94% to 86 to 88% after once you're past 6 months, that's only 12% of the people that are left a little bit more vulnerable. Whereas all of us who are kind of sick of it and sick of COVID, and we've been so good. And then now, it's tricky because you're relying on the population to come to you. But if the population doesn't believe in it and they're sick of it, right? So then that increases your chance of getting sick. And my thought is, well, if I've spent so much time trying not to get sick, I do want that booster because I don't even want to be part of that 12%. Like I want to be, so that's what I said. It's a tug of war. And I've seen arguments out of physicians both ways. And I've seen some physicians have gone in and gotten that booster dose because they feel that they don't even want to have mild COVID. And we talked, I know we're going to talk about this a little bit, but some of those mild COVID symptoms, like just because you have mild COVID doesn't mean that you don't have symptoms for months on end. And
Yes.
there's been like clear studies to show that even if you don't go into the hospital, you can have these long haul COVID symptoms. And not only in adults, right? It's
And children.
even in children. And I think people have to realize that because I know on my Facebook site, and some of the Instagram site, I did put up the study where they studied kids like from zero, they studied people zero all the way to the elderly, for those long haul COVID symptoms.
Mm-hmm.
And, you know, all age groups can have like fatigue, those memory deficits, those cognitive deficits, that can persist longer than 6 months.
Yes.
So the hard part is, do you want your kid to be that one? And how do you know your kid's not going to be that one? Right? Or do you want your parent to have that? Right? So I think that's where it becomes very tricky. I personally have not gotten a booster, but like I said, I know several physicians who have gone in and had it done, basically modeling after what other countries have done because they feel that their immunity is waning after 6 months, even though, like I said, current guidelines do not suggest that.
All right. I think that if I was probably in the
Hmm.
if I was in the ICU or if I was in the ER, but I think I kind of like
Yeah.
the idea of the like I did Moderna, so I would be looking to get a Pfizer or a J&J. I'd like to get something different to kind of try to get a little bit
And
of
there is a lot of data supporting that,
yeah.
right? So like there's
Mhm.
people that got the one dose J&J and then went back and got a dose of Pfizer, which they've shown actually augments some of your immune response.
Right.
So I think those would be good ideas.
Yeah. So I think that I think that we'll be seeing. I mean, things are coming across very quickly. So I think that at this point, I would think that watching and waiting, unless you're at extremely high risk, is probably a good idea. And of course, from the public health standpoint, yes, I do have a little bit of an issue with the fact that we are on third doses, and there are millions and millions of people, billions of
Yes.
people across the world who don't have access to any. And so I do feel, that I agree with the WHO that, you know, I mean, it should not have to be that way. So I kind of would rather, but of course it doesn't matter if they aren't sent over there anyway. So if they're just sitting here and they're not going to go overseas, or then it doesn't, it's a
Well,
mute
and
point, so.
that's the question. Like you said, there's some that I know that have been sent over and then, but they, we also have enough to provide for the boosters for our
Right,
population.
right,
And so the question is, where in that 6 to 12 month period is it going to be, recommended? Like,
right.
because we know that after 6 months, things start going down, but where in that 6 to 12 month period? And that's, I think, yet remains to, there's not clear enough data either way to be able to tell.
Right. So stay tuned and we'll see about that. And I think that I know actually when you were on last time, we had talked about having you come back to talk about long haulers, and that's probably that's a whole segment. So because she gets to see, unfortunately, for better or for worse, she sees the long haulers. I see them, but I see them kind
Mhm.
of. I'm actually starting to see more. Um, um, and because I do, like I said, I do a lot of hormonal therapy, so I'm seeing a lot of menopausal, perimenopausal women, but I also do a lot of wellness therapy and even in men as well. And so the big one that I see, of course, is the fatigue. And so and people think,
Yeah,
well, is it because I'm going through the change of life or whatever? But when you go back, yes, when you
right.
are perimenopausal, menopausal, yes, fatigue is a common side effect. But this crushing, just pressing fatigue that you cannot do anything about, that one is huge after COVID, and many people have it, and they just don't necessarily attribute it to the COVID until after you kind of sit down with them for a while. And like I said, when I start doing the history and start going back, I'm like, did you have COVID? And then invariably it's like yes, and it's like, so that's just
Yeah,
huge, and people don't realize it, and it doesn't matter whether the case is mild, moderate, or severe. Almost everybody has some degree of fatigue, and the younger people actually sometimes notice it more than the older people, because you have athletes who need to be at peak performance and they can't. And like my daughter is plays golf, and every child now, regardless of age, had to get EKGs uh, to uh, to check out their hearts before they were allowed to do any tryouts for sports this year. Um, and
yeah,
and and the reason why, because a lot of people are like, why did I do this? And I mean, it was a pain. I mean, it was really pain. But that's because a lot of kids have not been tested. So there are people that are out there who have had COVID and don't know they had it. They were asymptomatic, and they are finding that that in these children, that they can go out and they can become severely ill and they can die. And so they have to know that before they put these kids through strenuous activity, that their hearts are stable. And so that was something, obviously we've had sudden death syndrome that has occurred before COVID, but now it's at even
yeah.
higher risk. And so these are some of the aftermath things that people don't realize, that all of this can is all tied back into COVID. And I have people that you know um, had COVID, went away, they were sick for like a week, they're fine. They don't notice any residual symptoms whatsoever. And then I have other people that go the whole gamut, where, like they just are always tired, or memory huge, memory just can't remember the same way they used to. And then I was just talking to a young lady this week, and to the point where she literally, oh, insomnia, of course, and where she literally just has days where she just can't function, and where she can't even recall what happened. Where she looks up and can't remember.
Yeah,
You
yeah,
know.
and like you said, they're trying to, it really affects your work performance. It affects for kids their school performance.
Yes.
And obviously for, especially for those that are, if you're thinking that you have a child that, is working towards an athletic scholarship, that's also something to think about is like,
Yeah.
do you want, if your child gets this, like, you don't know, like, because there have been, I've had some parents come and tell me, well, my kid's such an athlete that they would be fine. And that's not how this disease unfortunately works, because we've had Like I've had personally young athletes that, still months later are having difficulty breathing. Two, I've got several in the practice that just have chronic long-term lung issues that they're having a hard time resolving post-COVID. And maybe they were young and healthy and they have a mild defect as opposed to somebody who's older that would have a severe. But the point being is that they're not able to compete in their sport at this moment, and especially at the level that they want to compete
Right.
at because COVID has affected their lungs.
Right.
Or we have other ones that I have other teenagers that can't taste or smell for the life of them. They can't, and have lost tons of weight because they just don't enjoy eating anymore. So, point being, not that I'm focusing on these teens or anything at all, but just point being is that you really can't figure out whether, like, who's going to be the one that has these long-term complications. Like I said, if we could find the who, that would better be able to predict and maybe give some parents more impetus to say, hey, we should get our kids vaccinated because they're in this high risk, kind of like back in your field for breast cancer, right? Where we have the markers
Right.
for breast cancer, where the BRCA marker, where moms or women can actually make a choice. Like, do we want to have a mastectomy? Do we want to, like, how aggressive do we want to be with this?
Right.
And that just doesn't exist for this right now, unfortunately.
Right, right.
Yeah.
And so as science evolves, as we learn more, things may change. But right now we have to do
Yep.
the best we can with the information that we have. One other thing, it's after 5, so we're going to get off. But I did just read a study this week, and I'm sure you're familiar with it. It was a small study, and it's not peer reviewed yet. But where they took people that were both vaccinated and unvaccinated and partially vaccinated, and they did CT scans of their lungs. People that got COVID, and
Yes.
they and in this particular study, there was no one that was fully vaccinated, double vaccinated, had lung changes, and they saw, and I don't have the numbers in front of me, but there was a smaller percentage for those that had partially were vaccinated, and then they definitely had lung changes in the people that
Yeah.
were unvaccinated. So once again, when you think, okay, why am I getting vaccinated? This is what we're talking about as far as keeping you out of the hospital, out of the ICU, and out of the morgue. This is protecting you, even if you get sick. Yes, nobody wants to get a cold, nobody wants to get flu-like symptoms, but you don't want to have long-term lung disease, and so the vaccines definitely appear, at least in this particular study, to definitely be giving positive um, changes and protection in the lungs, which is
Yeah,
important.
and it is super important. And we, like, just my biggest point is, like, even going into the fall, just talking about things for adults, children, everyone to do, just to plug for like the flu vaccines, because they, like I said, we also had another study that came out that showed even if you got the flu vaccine, your chance of serious complication in COVID, like ICU admission, was 20% less, even in the patient population that received the flu vaccine. So there is a reason that not only, like, okay, are you going to protect yourself against the flu, but potentially protect yourself from serious complications of COVID. And a lot of us were wondering why. Like, why does that make sense? Like, why, if you got a flu vaccine, what does that have to do with COVID? So what they're thinking is that it primes your innate immune system, so it's ready and active to kind of, fight. So, just as a plug, just remember, we are obviously, like I said, RSV, we're going to RSV, we're going into a lot of things heading into the fall. Just to remember to get your flu vaccine as well. And just because you have the COVID vaccine doesn't make the flu vaccine unsafe, right? So they're doing these studies where they're combining, like they combined the pneumovax, they combined other vaccines on the same day. Um, I haven't done it with my patients, even though, like I said, the data has been very favorable, only because, like, that way I can really isolate what happened with the COVID vaccine. However, like I said, that doesn't mean that just because I get my COVID vaccine on September 1st, I can't get my flu vaccine on September 7th, right? So just keep
Right.
in mind to remember to get even your flu vaccine because that should help protect you as well.
Yes.
especially from those serious complications.
And that's the goal. Stay out of the ICU. Stay out
Yeah.
of the hospital. Hopefully, definitely stay out of the ICU, and we definitely don't want to see you in the morgue. So that's my motto. That's what we're looking for. So, as always, it's a wonderful thing when you come on. I'm really excited that you came on because, like I said, I'm just sitting there talking, and I just feel like people are like, oh, there she goes again. So it's kind of nice for them to hear things from someone else. And like I said, and then since you are on the COVID task force for for your society, and you guys are the immunologist, and so you know the latest greatest and all of that stuff. So it's great to hear it from your perspective. So I am really excited that you came on, and I hope that you guys got a lot of wealth of information from Dr. Banzal, and will hopefully we don't have to have her come back on because we're into another fifth wave. We don't want that. But like I said, maybe we'll do another one
No.
where we talk about some long haulers and some stuff that we can do. And one more thing about the long haulers, there are centers out there. So for the people that are really not doing well, first of all, if your symptoms are even mild, seek out your physician, talk to them. Um, uh, once again, there's telehealth. It's easy. You can meet with somebody. You don't even have to go in. So if you're and there are things that you can do to try to work on those symptoms. It's not something you necessarily have to deal with. And if you have really bad long COVID where it's really affecting your life and you're not getting the help that you need in the local setting, there are centers specifically made for long haulers. And so the internet's your friend. I know there's one is it Rush in Illinois, and I know
Yes,
there's
Rush.
one in New York City. I don't remember the actual. I don't remember if it's Einstein or where that is, but they're there. So the internet's your friend. Go on, look it up, get an appointment. If you're one of those people that needs it, because it is definitely there are things that can be done. Look into Dr. Bansal. Do
Yeah.
you take outside of the state, or are you able to do? I know they just came. They changed some of the telehealth laws as of July 1st, but
But yeah, as long as, like I said, we've been kind of watching, as long as I'm still covered with the telehealth laws, we've been, we're still using telemedicine in the clinic for those people. And like I said, I am seeing quite a few consults still about should I get the COVID vaccine, should I not? And these are the conditions that I have. So, um, like I said, if you're on that fence, please seek out your provider. Because, especially if there's something that you're confused about, seek it. If it's, hey, I'm confused about, I had cancer 10 years ago, we'll talk to your hematologist oncologist. If you're saying, oh, I have a history of, like I have a history of BRCA and I'm worried about myself getting breast cancer if I do this. Okay, this is where, here you would be the best resource for them, right? So I think seek out kind of whatever your hang up or your question is, please seek out the right person to be able to help you. But
right.
I really thank you so, so much for having me on to show this is awesome and all of the work that you're doing in the field. Good information and not misinformation. So I love it.
Yes, that's what we try to do. Is give good, sound medical information because that's our job. So, and to make sure that
Well,
people are as healthy as they can be. So that's my motto. And as always, guys, we're gonna let you go. We ran a little bit over, but not too bad. And as always, it's gorgeous here in Florida, and we are not masking outdoors yet. So get out, get some sunshine. Just stay away from people that are coughing and hacking at you, and maintain your spaces. But have a wonderful weekend. As always, stay healthy, stay safe, and I'll see you next Friday at 4 p.m. And thank you for coming on, Dr. Banzal, and I will talk to you soon. Bye bye,
thank
guys.
you so much, guys. Bye.